I'm called Dr. Lawrence Basariza. I am a Updf doctor who has been delegated to lead a team to this region in the Tarehe Sita activities as we prepare to go for the celebrations on the 6th. I was tasked with 2 districts, Namutumba and Bugiri. And in those areas, there are areas which was chosen where we shall handle various medical activities. Out of the main activities we are supposed to do here, treatment of people, operation of people, that is surgeries. Under surgeries there is circumcision and the surgery of other ailments. And the treatment is for general medical outpatient problems. And what they is bulijjo. And operations are mainly for minor surgeries, which we can handle immediately and people go home or are kept a day as we are still around in the area of operation. So in Namutumba we were there for 5 days and we saw a great number of people. And the centers where we worked was the Nsinze hospital, where we had the 5 days of the circumcision and 5 days of OPD. Other centers which were visited was Ivuluku and Buluguya, 2 to 3 days. And indeed in that area we worked on 4,200 people as a general outcome. Circumcision, those numbers are yet to come out. I think they will be forwarded to the CPC for the final evaluation or data management. Now we came here 2 days ago and we started working yesterday. This is Bugiri. The turn-up, as you can see from the background, the camera can show, is great. Yesterday we saw about 600 people, and I think it will be the same number because people here are focused. They are not just coming because we are here. They are coming because they are sick. So what you see here is a patient. They are not those who are coming because they are coming to look for what? First aid. They are coming to be treated. So I believe these are genuine patients, and indeed when you work on them they go and they don't come back like it has been going on in other areas where we have visited. Surgeries have started today because yesterday we were booking. The surgeon is doing his work in theater. Circumcision is starting. They are also booking patients. They have been given an area to work on, and the OPD is going on. Yesterday, on top of the medical management and the surgery, we had dental services. I think they saw more than 150 people. The number will be forwarded. It has already been forwarded. And the ophthalmology also was here. Ophthalmology is the eye. They also did about 150 people and they gave out 100 spectacles. Generally, I think the whole exercise is a success, although we are still in the wee hours of the exercise. The exercise is a success. From the Tarehe or the telling books, infections of women are more than those of men. What do I mean women? Infections in the reproductive system. They are more here. I don't know what is the cause, but somebody may do a research and tell us why. Yeah. Those are very common. Malaria is little. People here, I think they sleep in the mosquito nets. But the infections which affect the reproductive system are the problem here. All the area we have visited is the commonest problem. Ndwadde z'abakazi mu Uganda. Nze bampita Lawrence Basariza, ndi musawo w'amagye. Era nasindikibwa okujja wano okuva lwe twatandika emikolo gino egy'okujjanjaba abantu mu bitundu by'e Busoga. Bampa amadistrict 2, Namutumba ne Bugiri. Twatandikira Namutumba ennaku 5 era twazimala ne tulaba abantu 1,400. Ab'endwadde zonna kitegeeza okusala wakati wonna kati tewaalimu manya zonna ndwadde ezo. Ne tulongoosa era abantu abatakawa 20 ne tusalamula abantu kusinziira ya program ene eziyiza mukenenya abalwadde balinga 25 si balwadde wabula client nga 25 era ennaku ezo bwe zaggwa ne tudde eno tuli wano twatandise jjo mu Bugiri era mubalaba emabega awo abantu weebali era bangi era bajjumbidde okujja ne tubakolako era basanyufu nnyo era olunaku lwajjo twalaba abantu abatakawa 600 era nsuubira ennaku ezinaggwerawo tujja kuba mu 10,000 nga ze twalaba eri ebitundu bye tugenda okukolamu 3 naku 5 tujja kuba mu town council eno ndwaliro lino lyenyini gye muyita Nankoma mwe tujja okukolera okulongoosa n'okutayirira n'okujjanjaba endwadde eza bulijjo. Ekifo kiri ku mwalo wansi eyo kilomita ziringa 18 okuva wano tujja kukolayo ennaku 3 naye nga tujjanjaba endwadde eza bulijjo zabayita endwadde zino ezijjanjabibwa tezitakisa kuba kitanda oba kulongoosa ennaku 3 era ennaku 3 bwe zinaggwaawo bwe zibe pap nga tusengula ttiimu eyo egende eri gye bayita Buluguya era center 3 bakolere ennaku 2 kolere ennaku meka bambuuziza ekibuuzo nti bwe mukulabako ndwadde kyezisinga okukuluusanya abantu wano ate mu luberebere mwangambye lwaki abakazi bangi abakazi banoonya okujjanjabya abasajja bazibu nnyo byokunoonya obujjanjabi kubanga yasuze n'omukazi nga alina ekizibu amukeeka ssente bwakasooke obulwadde mbuteeke ku pembeeni sooke noonyeza omukazi ono ki ekiguli amagala eddiba so they die like that but now bo bazze endwadde ezisinga okubonereza endwadde zaabwe era kyezibaleese wano ez'obukaba endwadde z'obukaba naye tujja zijjanjaba era basiimye era bagende bajja kuba bulungi era tewali buzibu.
Byobona Amina. I'm the facility in charge for Busesa Health Center 4 in Bugweri District. So we want to thank the government of Uganda and the UPDF for giving us this opportunity as Bugweri to come and serve our people to treat them the different illnesses. This medical camp is starting today first and to end on 5th. So the mobilization has been good. This is day 1 and we have a good turn up. We are doing a lot of services. We have specialists in ENT, we have gynecologists, we have surgeons, we have physicians. So we are encouraging people out there that the camp has already started. We encourage whoever has any medical illness or surgical illness to come to the facility for these services. They are free of charge and there is treatment for all conditions. So we want to thank the UPDF in particular because they've added us special people who are going to help us treat these people in this facility for the 5 days. So we want to thank everyone and the community for responding, and we want them to increase the turn up. We are also doing cervical cancer screening for the women. So we encourage whoever is 25 and above to come for this service to screen whether you have cancer of the cervix or not. Thank you. So we've been having challenges in those special cases like the ENT. We don't have an ophthalmological officer, but we are happy for this camp. We have an ENT specialist, and then we also have the ophthalmological officers that are coming to help us to treat people who have eye problems and then ENT conditions.
Amina gange bandeta nafula Edsa mwene nva Buluguyi parish Bufunda village Gawunire neyanze ino abasawo baife abayidye okwitwidandaba era ndidye wano nga tibona bulungi era mbayire nga tibona bweninga ku mukitabo nga tibona aye sawa dino ndibona bulungi ne namba debafa kumpa nvu adisoma bulungi era neyanza ino abasawo baife aba UPDF bayidye okutwidandaba bambi kabiri batuwaire gago kubwerere kale tuli kubiriza ni banaife bona abasigayireyo bayide babeyidandabe era bali twidandaba bulungi tibali kutusaba sente bali twidandaba bwereere mwide babayidandabe.
I'm Warrant Officer Class 1, Buluguya Francis, Public Health Officer. We are for a vector and vermin control exercise. We have so far handled Bugiri District, Namayingo and Iganga. We are right now in Bugiri. We are doing indoor residual spraying, IRS, at Bugiri General Hospital. This exercise is important in fighting against mosquitoes, the vectors of malaria, and any other mosquito-related ailments. So we are right now doing IRS, indoor residual spraying, in all the wards, because we realize some of the inpatients have been suffering mosquito bites and they can easily contract malaria. So that's how helpful the exercise is to the community.
Nachesa Barbara, Assistant Nursing Officer, Midwifery. I'm the in-charge MCH department. On this great day, let me take this opportunity of thanking Updf for the tremendous work that they have really done with us. We are so grateful. On behalf of MCH, they have been very cooperative. They are kind people. On antenatal days, we have been there with them, palpating mothers, taking history, health educating, and really mothers, you know, at first they had the fear that UPDF, we are not easy people, but at this time, they have really proven it. They are very hardworking people, and they are really appreciated for the services. On side of delivery, we have been having mothers who are in labor on a daily basis, and we have been conducting deliveries with them, monitoring mothers on photographs. We had successful deliveries. We have conducted 10 deliveries during that time, and we really appreciate for their services and the time they have really offered to us. Also on the side of YCC, that's we carry out immunization, we have been together with them, and they have really given a hand, a very good hand, and we have been cooperating. We have been with them since morning up to evening. So on behalf of Nakalama Health Center 3, I've really take this opportunity to appreciate for the tremendous work the UPDF has done to the community.
I'm Captain Brian Rutara, heading Team 4 of Voluntary Medical Male Circumcision, that is working in the areas of Iganga and Bugweri. So far we have worked on 250 clients, and people are yearning for the service because of its medical benefits. We started on Friday, on the 25th of January, and we're still moving on up to the 6th of February.